I think when you open the door to that and you're willing to have those intimate conversations with people, what you find is something, and what they find is something that can be very self-motivating for them. Because that, again, contrasts this external motivation, me rah-rahing and saying, you shoulds, and here is how, and them kind of having that intrinsic motivation.
Welcome to the WellSpan Podcast. I'm Scott Fulton. Good to be with you again today. My guest is Dr. Cate Collings. Dr. Collings is a quadruple board-certified physician in cardiology, internal medicine, nuclear cardiology, and lifestyle medicine with a graduate degree in exercise physiology and certified health coach. To put that into context for you, less than 0.1% of physicians possess such breadth and depth of knowledge and expertise. She's truly a special guest. Dr. Collings is past president of the American College of Lifestyle Medicine and delegate to the American Medical Association. I'm delighted to share that Cate is also a friend, colleague, and thought partner, particularly on the subject of human behavior. There's still much to be learned, but the big questions of what to do for health span and longevity have mostly been answered. It's the why behind the 35,000 or so daily decisions we make that are harder to understand because so many are deeply rooted, often based on weak evidence, and some frequently contradict and undermine our values and futures. Human behavior is nothing short of fascinating, and modifying human behavior requires a rare blend of physiology and psychology. It's complicated, and it demands a thoughtful, nuanced approach, a skill Dr. Collings has honed and why she is a highly sought-after strategic advisor and executive health coach. Some of what she shares will surprise you, and I can assure you there's something in here for everyone.
Cate, welcome. It's just a delight to have you on the program today. You and I have had many conversations focused around education primarily. And you have a lot of passion for that and many other things too. But when we kind of get right into it, I think we agreed a great topic for you and I to have that would allow me to explore some thoughts and experiences inside of that vast repository of information and knowledge is really around the aspects of coaching people around that health space. I think it's one of those areas that we hear about coaching. Some have had coaches, but the vast majority of us have not. And I'm not sure why we haven't. I think it's a bit of a black box for people. And so I'm really looking forward to us kind of diving into that and seeing what you can reveal to me and the listeners around just what is coaching and kind of the different places we can go with that conversation, if that's okay with you.
Mm-hmm. Yeah, pleased to be here, Scott.
Great. So I mentioned in the intro, kind of you have quite a significant history and meaningful work that you've done, and that's probably unique in and of itself. But then also to see you kind of land in saying, coaching is really where I think I can do the best work and my best work, the kind of work I have a lot of passion around is when you've talked about it in the past. And so maybe you can kind of just give the highlight journey of kind of how did you land in this place, given what your past experiences were. I suspect there were some events along the way that kind of led you to us being here today.
Sure. Yeah. So, I started, and just so the audience knows, and I know you've given some information about that, but, through my years of clinical cardiology, I walked the walk and talked the talk of lifestyle, and lifestyle is often related to health behaviors. And I modeled it, and my patients knew that I had a passion about that, and they trusted that this was important. And yet very few of them were able to change anything. In fact, oftentimes when I with the limited time I had, and it was limited, imparted some education, maybe gave them a little inspiration as they left the room, or it might be something as modest as try to eat better or try to move a little bit more. Oftentimes, I found that actually moved them backwards. In other words, they went out and they tried to source this information. They didn't really have the support. And when they came back to see me, in many cases, they had not done anything and they felt shameful about it, which was the last thing I wanted to have occur as a result of that. I went through a period of time in my career where I really felt the beginnings of burnout because of feeling ineffective. For me, that burnout was more on the order of moral injury, I would say. Felt like the corporatization of medicine was interfering with me being able to provide the care and healing for my patients. And so I started to seek a different route, and that led to some career coaching for me. And it was in that experience as being on the other side of being facing a coach and having questions posed at me that allowed me to experience coaching and see the possibilities. In this case, it was career coaching, but the same principles apply to health coaching, which is asking the right questions and creating the curiosity and the environment with which people will be able to move forward on their deepest wishes. And for me, it was to find something that was more satisfying in my career. And so that led me to the field of lifestyle medicine and then now to the field of health coaching. But to tell you a little bit more about how I started to make that change from inspiring patients or just modeling or going out and doing community lectures and informing people about heart risks as in this situation or lifestyle risks, I started to, in the patients that I could, completely shift from an expert hat to a coaching hat with some of my patients. And how that took its form was to ask a very open-ended question to many of them. After we'd done all of the things that had to be done in the medical appointment, the vital signs, the exam, diagnostic tests, medication refills, I would shift and ask a patient, do you think there's anything in your day-to-day life that is influencing or driving your symptoms or this condition? And in some cases, I didn't ask for an answer on that necessarily on that day. I said, think about that, and maybe we can talk about that next time when we meet. But very often I was met with a response from a patient who might say, well, yeah, but you never asked me about that. Or, well, duh, doctor. Because it was sort of like this compartmentalization of all these things I didn't know to ask them, and they weren't going to be forthcoming in without the question. So when I started to experience that, as hard as it was in a medical model, and it really is hard in a medical model, if you will, to have those conversations and to make that shift between being the subject matter expert. I mean, obviously, I know what you should do in your day-to-day to make your life and your health better.
Sure. Yeah.
But that wasn't the issue. The issue was asking them and from a curiosity and a coaching perspective. So that was a kind of a game changer. That was exciting to me because I'd always been the kind of physician that integrated mind-body medicine and had a holistic approach. I was fascinated with, how emotions could drive cardiac arrhythmias, as an example. So I was always interested in the mind, although I wasn't really trained as a psychologist and so forth. So this area of health coaching started to get me very excited to know, because I thought, this is what we're missing. And if you want me to go deeper into that, I kind of like to talk about education, public education, and counseling and how that contrasts with coaching. I think I've demonstrated a little bit, but maybe to go into that a little bit more.
Yeah, I think so, because that's what I kind of set it up with. Like we tend to, for lots of reasons, we tend to focus on education because those are kind of the supports that kind of are the framework. But
Mhm.
ultimately, all of the behavioral activities operate inside or outside of those aspects, right? And that to me is that's where the magic is, because there's all the interpretations of it. It's the what do I think I'm doing? What do I feel about certain things? And that changes, sometimes at the drop of a hat. So yeah, I think that's really this figuring it out, because I'll kind of say what I get frustrated with, as I think you and many of our colleagues do, is, well, just tell me what I should do,
Mhm.
right? Like, just give me the list of things, as though that's the answer. And it's like, really, if it were just that simple, this is the list here, and I'll see you next time, and we'll find out how much you didn't do. And this really gets at the reasons why. So yeah,
Right.
I
Yeah.
think that's really, that interface is really, really important.
Yeah, I think you're absolutely right. People think that if they just know the right thing to do, but of course, then they get confused because they go out into the marketplace and the media is telling them all sorts of things. They don't know how to discern between what is evidence-based and what is not. And so they can go down a lot of rat holes in even saying, tell me what to do, because they have a lot of authorities out there saying, this is what you need to do, X, Y, or Z. That can put people kind of into neutral. Well, I just won't act at all because it's too confusing. So I think, that is one obstacle for people in terms of making the transition, as you will, from education um, and knowing, if you will, to their own health behaviors. But if we back up just a little, a lot of it is how we've trained patients. So if we go back a little bit and we look at heart disease itself, since that was my area of focus, and we look at the 70s and 80s, we had this huge acceleration in pharmaceuticals and procedures that could benefit people. And I think people became very acculturated to the fact that there was going to be another medication or another procedure that was going to help them. That they didn't really have to make that change, that was a minor piece of the whole equation. And then in the public education arena, we educated the public on these intermediate risks, right? We implored them to have your blood pressure checked, have your cholesterol checked, have your glucose checked, and see your physician. Of course, when they see their physician, they go into that paradigm of medications, again, with very little talk about their behaviors. So the public education kind of, again, looked at those intermediate risks, but the real risks for all of these intermediates are lifestyle behaviors. So if we were really educating around the lifestyle behaviors with the same vigilance that we educate around the intermediary risks, I think that we would have a population that knew more about their everyday habits and how that affects their health outcomes. They very much believe that the pharmaceuticals, I think, and their genetics are the two pieces of the equation for them. Does that make sense, Scott?
Yeah, and I think the maybe it kind of bolts on a little bit. One of the areas I really try to raise up is objective metrics versus subjective metrics, and so where I think you kind of touched on it there without raising up as much, was where we tend to compare ourselves. So when we say lifestyle behaviors,
Mm-hmm.
that means, how am I relative to the other people in my sphere? That's what
Mm.
I'm measuring against as a subjective comparison. Well, so long as you live in your little pond, depending on which little pond you are, that could be really good news, really bad news.
Hmm.
Um, as a nation, we're still one pond in a global population, and the U.S. pond has not been doing very well over the last number of decades. It's been on a steady slide. And so as you and I as individuals says, who is it we're comparing ourselves when we say lifestyle behaviors? We aren't really comparing it against the kind of people we probably think that we are, right? So I think that kind of gets at what do we think we're doing versus what we're really doing. Um,
Right.
and it's not a criticism, it's just these are the realities. This is how
Right.
humans operate, right? From behavior models, we model our behavior after our parents and our siblings and things growing up in our community.
Right.
And so it's only natural that what we think is normal, um, it's only normal in our little our
Yeah.
little sphere. And I think that's where you're trying to kind of touch into here is when I think any conversation around lifestyle behaviors, if we don't put some context around it, it becomes really vague and again, kind of ultimately paralyzing because they realize they don't really know what that means.
Right. And to some extent, you're saying that having that objective measure is is a necessary, or is a necessary part, but is also not completely sufficient, because then people
Right,
have to kind of go internally
right,
and in a more subjective way. But absolutely, as a foundation, people understand. And I guess if we look at the objective things, about, even though they may feel like they're doing more exercise than someone else in their social sphere, about 25% of Americans are exercising, according to what are pretty modest US guidelines about exercise in terms of weight resistance and aerobic conditioning. And what people don't probably know, and a fact that I just came across, which was about 900 deaths a day are linked to poor diet. So that could maybe be them as well, right? So, those objective uh, values, and to your point, personalized to them so that they actually know where they are critical. So I guess I would say education in those objective measures is necessary, but not sufficient. Um, because this kind of goes back to people telling people what, as a subject matter expert, versus asking people about their lives. And I think
right.
that's where coaching comes in.
Yeah, yeah. Just as you're saying there, I think anyone who's been paying attention at all is aware of the 150 minutes a week, WHO when US adopted.
Yeah, yeah,
Well,
yeah.
and then you go out and ask people, is that a walk around the neighborhood 150 minutes a week? I do that. Does
Yeah,
that qualify?
yeah.
Versus, someone who's doing, 150 minutes, every day or two of some pretty intense exercises.
Right,
How they measure those and how they apply them will clearly be different. And again,
right,
we'll see both extremes, but usually, yeah, just having an objective metric isn't enough if we don't really understand, well, what does that actually mean?
right, right. And the
Yeah,
details within that.
right,
Yeah,
right. Yeah, and
yeah,
that takes some effort on the part of, for us to be able to help people interpret, and it takes some effort or knowledge, at least in practice, to be out there doing something to say, oh, okay, like to get far enough along and say, oh, now I get it. I've got a heart monitor or whatever. I've got some way of, I'm actually breathing hard now or something. This is what they
right,
meant, right? Um,
right, right,
yeah,
right, right.
yeah. It's we're all very practiced at this point in life around things we assume we know. I even see it on the housing side, right? To try to educate someone who's owned a home for 50 years, to educate them around how that's not going to, that same home and their knowledge base isn't sufficient for that home to be their place to remain for the rest of their life, even though that's absolutely their intention, right? So
Right, right, right.
we get disconnects happen very easily, very naturally, and become very, very entrenched right, over time. And I think that's, again, anything we talk about behavior is how ingrained are those beliefs and behavior
Right,
patterns, right? And that I would think as a coach is one of the key areas
right,
to understand is how malleable. That's why, we like coaching kids sometimes because they're malleable and they'll do anything we tell them,
right,
right?
right,
The older we get, the bar or the barriers go up around being able to do that. So, sorry,
right,
I took you sideways there, um, but yeah, I just think everything everything around helping people understand what that self-talk is for
mm-hmm.
them, right? And helping to interpret that. So how do you kind of maybe get at that? Well, if we call it self-talk that have resulted in the patterns of behaviors that they have certain beliefs around, and
Right,
right or
right,
wrong, what's the process maybe about trying to kind of peel that back and
right,
try, questioning, measuring what do you
right.
find works for people that they start to get engaged in the whole process and get excited and that curiosity that you mentioned earlier.
Right, right. Well, and to just level set, so you brought up, for instance, coaching kids and how malleable they are and so forth, and so really to create some kind of distinction for the audience between you know maybe fitness coaching specifically, or other coaching or football coaching, right, or any of those, tennis coaching, whatever, where a coach puts you kind of in a boot camp, right? And people need to double down and plan to hurt a little bit, no pain, no gain, um, but aren't asked to necessarily go inward and look at some of their inner talk or their, uh, yeah, and they're not asked to really necessarily go to deeper. Here's the training protocol. Let's do it,
Right.
right? But if we look at health coaching, it really falls under the International Coaching Federation's definition, which is partnering with people in a thought-provoking and creative process that inspires them to maximize their personal or professional potential. And so at its source, it's kind of untapping and working with imagination and curiosity. And and it also asks, I think, the coach to have a beginner's mind, not to know what is right for the individual, but to begin to ask the right questions in a non-judgmental way that people will begin to hear themselves and their own answers as a way to take a larger view of where they want to go with their health. And when they get into that, and if the coach can, again, do it in such a non-judgmental way through the questions and the curiosity and attaching emotions and feelings and values to that individual's desires in terms of their health, that, you know, gives a lot of stickiness to health behavior change. And so there's a lot of uh, very smart people in the realms of psychology and positive psychology who have adapted many different theories to coaching. Um, One of them, and I think it's important to know, is one foundational one is called the trans-theoretical model of change, and it explains a lot of why people can seek education but not be at the right stage of change to be able to actualize that in terms of making a difference, uh, for any variety of reasons. But a coach's, to give you an example, in that model, trans-theoretical model of change, the first one is defined as pre-contemplation, right? So it's somebody who's not even really considering making a change. I mean, they know all the information, but they're really not at a stage that they're just dabbling in it. So why even, you know, keep telling them the same information again, as an example? But then if you can move someone, and you can't necessarily easily from pre-contemplation, but then they go through contemplation, and then they go to preparation to your field. They buy a pair of shoes to be able to
Right.
run. So that's
Right,
their
right.
preparation. And then they go to action phase, and then they go to maintenance, and then they go to relapse maybe or something. So so a coach will deliver different interventions based on those stages of change. So that's just one theory that underlies coaching. It's very much almost never telling somebody what to do, but it is maybe guiding them to the resources where they can find that expertise. And for me, because I do have the expertise and the coaching, for me, it's a little bit of a dance. Because if I spend too much time with people in the area of understanding their medical condition and being able to apply the right lifestyle behaviors to help them, treat or manage or reverse that condition, we're very much in the expert phase, and we can easily go down a rat hole with that. But I try to stay, and what's most effective is if I stay in a coaching mindset and deliver the questions rather than tell, and have the answers come from them. In another interesting, theory in coaching that I think is valuable is called the social cognition theory, and that I think kind of aligns with what you were saying. Is people contextualize their lifestyle within their sphere, but it recognizes that there is this interplay of all these different factors in a person's life. And I think that's what's so rich about coaching, is kind of really coming to know the individual, their culture, their family, their day-to-day environment, their values, all of that is where there's a lot of richness in coaching, both, I mean, certainly for the coach, that's rewarding. But it also, for the person who's being coached to be, seen and heard is enormously healing, and can facilitate them working on their health behavior in the ways that they want to.
Yeah, yeah. As you're talking there, I was thinking of some students and people I've worked with directly. Is again the differences from working with kids
Mm-hmm.
is sometimes with adults, particularly kind of middle age and beyond, is a recognition of not just their own personal ambitions, but in terms of seeing themselves as wanting to be a role model. You kind of step back and say, what do you want to be remembered for? So I like to
Mm-hmm.
kind of say, what's the end game here? Like, where
Mm-hmm.
is it we're really
Mm-hmm.
trying to go at the very end? Like, and strip away all the other stuff. That's great.
Mm-hmm.
You have a $200,000 car in the garage and six more. That's probably not what's ultimately going to matter the most to you. It's often being that role model. Even like we say, people want to spend time with their grandchildren.
Mm-hmm.
So there's two parts to that. Is one is it's personally gratifying. I mean, it's just a delight to watch that change happen almost by the hour, it seems, with kids. But I think for a lot of them, it's wow, I have an opportunity to impact that child's life, and I'm going to have
Mm-hmm.
only moments of time, and that becomes really important. So that's like I find that interesting as a place. I'm kind of trying to look at different models that people don't even always think of.
Uh-huh.
But if you
Right.
strip it away, like, and that's what I think as you're talking about, how do
Yeah.
you get at the questions that really get at what do you value? Because if, in my experience, and tell me what yours is, people don't know what they value. And that to
Mm-hmm.
me is sometimes the most important part of this process.
Mm-hmm.
Because once you get their values and they get them sorted out, now they've kind of got their true north. And a lot of
Right.
things
Yeah.
start to now get to fall in, but without it, that true north, for lack of a better
Right.
phrase, I think that to me is fun, right?
Yeah.
Because
Absolutely.
you don't know what that person's true north is, um, but if you can be a part of that, that to me is so. So do you find that's kind of the way I've said it? Is that part of what you think you've kind of worked through with people when you
Yeah.
that's the ultimate? right? I would say
Yeah,
that we're not going to get there with everybody for sure.
right, right. Well, again, when you start coaching with a person, and I'll give you an example that was just one that I can always remember. You really are asking them at a very, very basic level, what's important to you as it relates to your health. And so I had this patient um, who was not English speaking, but she was brought to her appointments by her daughter, who was English speaking. She was Spanish speaking, and she had a litany of health issues ranging from obesity to diabetes to cardiovascular disease. And she had been referred to me in the context of as a lifestyle medicine expert. And the first question I ask her is, why do you want your health to be different? Right? And I had no idea. She might just say, oh, it's the right thing to do. Or she might say, well, I want to look better in a dress for my, such and such is. But what she wanted to be able to go on their usual Sunday family outings and lunch at the beach. And she realized that she couldn't walk very far and that she was holding up her family. So her deepest wish, and this brought her to tears, was to get physically healthier so that she wouldn't be obstructing these family outings. Now that became her true north. My true north might have been reversing her diabetes
Right,
or
right.
any number of other things, but that became her driving factor. And I find that for a lot of people, you talked a little bit about modeling, but for people in their mid and later life, or even who are in their active parenting years, oftentimes it can be modeling healthy behaviors for their kids. And that can be, or as you suggested, being alive to be able to see their grandchildren or being healthy enough to get down on the floor and play with their grandchildren or travel with them or any number of things. So that is, at the basics, one of the most key elements. And I think when people of health coaching, of any kind of coaching, I think, but I think when you open the door to that and you're willing to have those intimate conversations with people, what you find is something, and what they find is something that can be very self-motivating for them. Because that, again, contrasts this external motivation, me rah-rahing and saying, you shoulds, and here is how, and them kind of having that intrinsic motivation that
Yeah,
can
so
keep them going.
yeah, so now you've really got the framework, but something to stick to it
Yeah.
versus this kind of not knowing where I am and I'm told I should do these things, but I can't necessarily attach them, right? And so yeah, the like I would say just in my own experience, the more I can attach every little decision I make in a day, the easier all those decisions become. It's
Mhm.
like I don't feel like, you know, like doing whatever. Like people think like today I went for a run, right? I didn't really feel like going for a run. But
Yeah.
I've learned that just, it's important because if I don't do it today, because I didn't do it yesterday because of snowstorm and things, and tomorrow's going to be something else,
Yeah.
and it's only going to get more difficult. So why am I going to set myself for being more difficult? And I also know that once I get out there and I come back, I'm going to feel better for the rest of this day,
Mhm.
without question, right? Not not every day is a euphoric experience when you're doing it, but ultimately it's kind of like, you eat when you're hungry. It's kind of important to get enough calories in the course of a day, because if you don't, that's going to lead to some discomfort.
Yeah. Yeah.
And
Yeah.
that's kind of that same routine of
Right.
how I've kind of designed a lot of my activities. But I just find it also fascinating. So I just thought of another question while you were talking there, and this is totally unfair. So you can pass on it if you like.
Yeah.
I hear a lot of our colleagues who are big lifestyle proponents
Hmm.
around cardiovascular disease pitch numbers to say how much of heart disease is lifestyle. I'll say the most common is 80% of heart disease
Hmm.
is preventable through lifestyle. I'm not concerned about what the actual number is, but maybe you can kind of talk about, because it's a magnitude of order in
Mhm.
terms of, we talked earlier about you could take some medications for things like so impact of taking a statin therapy, for example,
Mm.
relative to the things that we could choose to do on our own. Can you talk a little bit about, because that's clearly from a coaching standpoint around what you're trying to stack the odds for them. And again, I'm
Mhm.
not trying to hold you to a number, but in terms of
Right, right, right.
relative importance of the work around coaching, like why would we want to do this work relative to just take a pill?
Right, 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 right. Well, I mean, I think, and again, in our sphere of lifestyle medicine, it would be saying, we're not addressing the root cause, right? We don't have as much data as we would like to be able to say that we know this medication is working on the mechanisms with which that drive inflammation in its totality. So if we look at the three mechanisms, cellular injury, the microbiome, and epigenetics, medications aren't kind of working in that. That's where lifestyle can work. So it's hard to make a comparison, right? It's hard to say, hey, if you just, this is more powerful than the next thing. I don't think we have the data to say that. So I, just plead ignorance on that and say, we have the capabilities of medications and procedures. Thank goodness we do. They're necessary in life-saving, catastrophic situations. We don't even yet know the full power of if we really took a lifestyle first approach and we really treated these patients with lifestyle interventions first and foremost. Would that take care of, a large percentage of this, and we wouldn't even need those medications? Sort of the medications and procedures are out of the barn. We can't really go back to those days, but an individual can with the first
Right.
presentation of their condition. The individual can take a real deep dive into diabetes reversal, sometimes before taking medications if they're not in a crisis situation. They can take a deep dive into behavior change, lifestyle interventions at the first stages of cardiovascular disease and knowledge of that before medications. So where do we stand on that, and where are the relative weights? I mean, it is just as you said, about 80% of of heart disease is felt to be related to lifestyle behaviors. And I think the stats are from the US burden of disease collaborators is that diet is the number one risk for chronic conditions, both in terms of morbidity and in disability adjusted life years. So, it's there, it's so there, whether it's diet and then you add exercise, and, 7 of the 10 top risks are lifestyle related. So, in context, I think that they are the number one thing that we need to address. But as we've been talking today, the knowledge is only part of it. It's really starting to work with people in ways that allow them to take that knowledge and digest it and put it into their own life and their own values, and move forward and not get stuck. I think you brought up getting stuck. I think a lot of people are stuck.
Yeah, I think there's a mix of some who know they're stuck,
Yeah.
right? And then some who are perhaps stuck even more, who um, who refuse to imagine themselves stuck because they're so busy doing, right?
Yeah.
We imagine that we're busy doing, so we have this idea of stuck being, in one location, physical stuck, that they're
Hmm.
not involved in things. But I'm sure you would find the same as, no, you need to slow down from all these busy things that you seem to think, that, you feel you need to do for validation, for whatever reasons may be
Hmm.
driving that. And, maybe it's you know, a basic need of like, you just have to work that hard to get enough, to earn enough
Hmm.
money to feed your family and pay your rent and those sort of things. So again, any number of reasons will drive that, right?
Right.
But I think the other, as you were talking there, I was thinking when lifestyle, I think, really starts to work, we don't we don't talk about it. Um, so I'd be interested in your thoughts. But one of them is we get this what I think about as the transformation, where
Hmm.
people get aligned now around, I understand, kind of go back to that true north. I
Hmm.
understand my values much better on the other side of going through this coaching exercise, this kind of revealing, like, what am I here for?
Hmm.
Um, what am I doing? And what I'm doing is now supporting what I'm
Hmm.
here for.
Hmm.
And that kind of, if nothing else, we would say is likely to have a lot lower stress associated with it and anxiety that you didn't even acknowledge you had before, perhaps,
Hmm.
right? And roll those together. And I remember Dean Ornish talking about in one of the interviews and saying, for all the things that we do, you know, if we don't deal with stress, really, that's the number one thing, right? So that to
Hmm.
me is kind of the things we
Hmm.
wrap around. Well, I can't give you a pill for stress, but I can give you a lot of things and a lot of work with
Hmm.
you around thoughts that will get you aligned, that will naturally build tools for managing stress,
Right.
limiting, recognizing it, but ultimately shedding a lot of the things from your daily routines that are stressing you that you
Hmm.
you might think feed your energy. That, right, this is where,
Hmm.
like, I always find it fascinating to find out who are the ones that are willing to come to the table,
Hmm.
right,
Hmm.
and do the work. I never know who that person's going to be. They
Right, right,
right.
right. Yeah, and I think you touched on something that I think is is so important. I mean, it's easily, stress is easily a big factor in all of this. I saw, enormous amounts of things like stress-related cardiomyopathies during my years, and I just again that realization that it is all these pillars of lifestyle medicine and how they all pull together. But as it relates to coaching and another thing you said, which is to slow things down. So I think in coaching, it's really important to not think of it as a boot camp. I referred to that before, but also not to think of it as like it has to all happen at once. I'm going to get this thing all whipped together and in shape, and then everything is going to be just fine for the rest of my life. I think that, in a way, can sometimes backfire on people, that overachievement. I'm going to run a marathon in 2 months. I'm going to do this. It's like, we have a lot of time we can work with this. Let's just slow things down. Let's see what is manageable as a first step. And then let's build on successes as you go forward. Again, this isn't a boot camp. It doesn't have to happen tomorrow. Let's pace this to your ability to integrate this into your life, your family, your work, everything. You're into your true north. What is it that your values and your beliefs and your desires, and then build the system and the framework to get you there. And I think slowing down a lot of times allows the coach to ask insightful questions, and allows the person who's being coached to relax and think about it and see what comes out.
Yeah. And so do you find in that process some natural milestones kind of come out of it that, again, that longer range plan, we'll say it's a year or two of
Right.
let's put that timeline. I don't know if that's reasonable. I'm not trying to suggest what's right or wrong, but just something. This is not a 6 week program that's now
Yeah.
going to suddenly change everything.
Right.
But what would be the milestones, perhaps for an individual that
Yeah.
would say these are the things, or whether we put them out in front or when they raise up, you can say this is a clear indication now of where you are versus where you were
Mhm.
6 months ago.
Yeah, I think that's going to be different for everybody and depending on what their health goals are. So, for instance, if somebody is really motivated to work on their cholesterol levels because they want to entertain the idea of coming off of a medication or not starting a medication as an example. Then some of their goals might be tied to, laboratory values. And then we might say, what's a reasonable time course? When do we want to have you look at those? That might be 6 weeks because we think you can budge these, or maybe it's 3 months. So I think 3 months is always kind of a good area. But again, it's not me telling them what they're going to work on. It's them saying, this is what I want to work on. And then us setting up the framework and the systems and the accountability and the skills, the tools that they need to get there. So, education being one foundation of it. But if getting to that goal involves cooking at home more, it involves cooking in new ways, then there's also some skill acquisition that goes into that. That alone has a little bit of a time element to it. So again, and some individuals, it might be weight that they're aiming to target as their goal. And again, they may, again, 3 months might be a good way to use that as a time metric in terms of their change. But I think in all cases, what we know about behavior change is that a slower integration leads to more stickiness. The person becomes a new person, if you will, through that, not at maybe their values, but they can now, that's just the way they live their life. This is the way I exercise. I am a person that exercises every day, or I am a person that does this. I am a person that, so it becomes ingrained in their identity. And I don't think that happens overnight. So I think, but it is all of that which cumulative adds up to their health outcomes and their health wishes.
Yeah, you touched on food, and I know you have a background in food as well. As thinking as the conversations I've heard over the years with people doing the dietary changes. So one of them you mentioned is, how often do you eat at home, right? The less you eat at home, the more challenging this will be. It doesn't matter where you live. You can live in a mecca for all great foods, but when it's prepared by other people, it means you're exposing yourself to other drivers and values in foods that your health is never number one in almost without exception. But that process of, did you learn how to cook? Is this before, or having to relearn, or is it the first time where you're having to learn to cook?
Yeah.
That's a big hurdle for people. What's in your pantry? Right? To kind of build that arsenal up of things. Well, there's a process of trying to find out what you like. And that's right. All these things will take, I think you touch on a really important part that I want to underline, and that's the aspect of time. Of rushing these things, you're not doing yourself any favors, right? Because unless you're cooking for yourself, you've probably got other people you're cooking for. And so it's this balance of, well, I need to come up. I don't want to be making 4 meals. That's not very sustainable, right, for everybody. And I'm sure you've run into that, people doing that. So how do you find foods that appeal to everybody? And maybe you're biasing portions based on different priorities and desires. And again, there'll be the journey. I would say even at home, where I have a lot of influence on the food because I do most of the shopping, I do most of the cooking, but there's still a process of myself and the family to take them through a journey where that curiosity, like I think you and I would be examples of people, we are constantly curious. This doesn't end.
Yeah.
Right? The more we learn, that's I think part of what I think is fun about sharing these the aspects of coaching, which you touched on right at the top, was really arousing the curiosity in people.
Yeah.
Because once they're curious, that's really where the possibilities start to open up, right?
Yeah. No, you're absolutely right. And it is the curiosity and their willingness to experiment. Hey, how about you try this? Or we've co-designed, let's going to try that. But it's not a success or a failure. Let's see how that works. And then come back and look at how we have to make tweaks to that. But, I'll use an example. I've run across a couple of clients recently who have been very passionate about, changing their diet to impact their health, but they were starting to eat without their family. And in both cases, they had junior high school kids, right? So now, the one person's having one meal and everybody else is having the other, which isn't necessarily going to, have durability over time, and doesn't foster what is so important about eating, which is connecting with people over food. So how do we design for them getting what they need and want? And they've clearly stated they want that in the context of the other aspects of eating and modeling healthy behavior for their family if the family isn't ready to come along on that journey yet. Right?
Yeah. Yeah.
So it can be quite it can look quite complex, but it can be adapted with some creative thought. So a lot of this is a lot of creativity. And that goes into, broader than the family, which is how do you go out and interface with people that are important to you and socialize with them, which is often around food. And still enjoy that and still be thriving, because that's such an important part of life, but not heading off of your health goals and your true north. So, I think there's just a lot of levels, and that's what makes it really interesting and enriching, and I think creative.
Yeah. Yeah. That aspect where people struggle when they go out in social settings, and so we see people who avoid going out because I won't, I can't go into that type of restaurant anymore, or
Right.
that person's home because I know they're going to hit me with all of these foods that I know I can't eat, and we see a lot of fairly extreme positions that people take, and where I kind of try to come into it would be around, it's the things you do every day that matter the most,
Yeah.
right? Versus the, if it's, if a family or a friend's birthday and you're feeling like you can have a small piece of birthday cake because that somehow is going to have some significant health
Right.
impact, you're not understanding, right?
Right.
It's not to say the birthday cake is ever going to be health food,
Yeah.
but that one event relative to, that's a once a month, for example, I don't know what that frequency is, relative to what do you have for breakfast 7 days a week, 365 days a year. Get that dialed in, because that's probably, in my experience, the one meal you probably have more control over than any other.
Right.
Okay?
Right.
Follow.
Yeah, it's absolutely, trying to get people, it's valuable if people take a really, set a high goal for themselves, but an iron fist approach, and one that is so concrete as to not allow, fluidity in certain situations, is not going to foster their overall health. So if you look at it in the big picture of holistic health, it's,
Right.
their stress. I mean, that can be stressful to have to navigate that, right?
That's exactly where my thought went as soon as you
Yeah.
said it. It's just immediately, it's now a stressful situation.
Yeah. Yeah. And then if you're withdrawing from social engagements, we also know that is affecting health mortality as well. I mean, in heart outcomes, right? We need social connection. And so when you start to look at it in that way, hopefully, unwind people a little, again, away from this boot camp, all or nothing, never or always mentality. You can find a place where people can live their lives, with flow and with joy and, not feeling restricted. because they're enjoying their food and they're able to navigate all these other situations.
It's for any of us who have been there and kind of down that journey. You wish everyone had, right?
Mm-hmm.
And so there's an element of how. That's what I think we're trying to do here is for an audience is to extend a little bit of trust around this because I'm sure in your own history and certainly in mine and those we've worked with and colleagues, we have seen this so many times with people, but you've got to get on the journey, right? You got to get started, right? That
Mm-hmm.
pre-contemplation phase, we have to get past there and
Mm-hmm.
and start to move into some actions. And that's really where I think the one of the other key roles with a coach is the accountability piece,
Mm-hmm.
which immediately changes. There's a bit of a maybe yin and yang around that. They're giving you help, but you're feeling responsible now
Right. Right.
back to them, which gets at that partnership relationship, which is really unique and is really strong, which kind of, I mentioned earlier that self-talk or inner talk now
Mm-hmm.
gets you exposed and vulnerable to somebody who's there only to help you.
Right.
Right.
Right. Right.
And what a uh, when I think about the work that you do, like I think it's such privileged work, right? To be able to have people open up
Right.
to have those conversations, those
Mm-hmm.
self-realizations
Mm-hmm.
and the discoveries along the way. It's a I think it takes a lot of knowledge to be an experience to really guide people gently through that process. You keep saying, this is not a boot camp, and if it sounds like a boot camp, that's probably a red flag around anything you've been looking at or considering, um, because this isn't like going, this isn't military where everybody has to conform to the exact same set of rules that has
Right.
to get up at the same hour of the day. Um, Ultimately, it's about helping you find what fits and works well for you in
Yeah.
your life, your culture, your family experience, where you're trying to go, which is unique to you and absolutely no one else. And that's where I think you as a coach
Mm-hmm.
are, we said at the top around trying to understand those things.
Right.
That's really where it starts because that now gets you guided around where am I trying to go with you on this journey.
Right. Right. And you're absolutely right. It does feel like a privilege to me. It was a privilege to be someone's cardiologist. Now it's a privilege to be somebody's health coach, and to be with them on the journey. And that accountability piece, the other piece that I think about that is, like we assume people are going to hold, I'm going to hold you, or we have a partnership and we've decided that the accountability is that you're going to do X, Y, or Z. And I'm going to know that you're going to check in with me in some way. But remember, I told you that feature of shame when people are not doing what they kind of said they were going to do, or in this case, that's actually a ripe, rich area to, instead of taking a shameful approach to it or a judgmental approach, to say, what did you learn from it? And I guess we need to tweak that. That's not a failure. What did you learn from it? And let's tweak that and let's change the game. Let's change the accountability. What is it that you need to be accountable for? Maybe this wasn't the right thing, or it was too soon. So again, being in the journey with people when they feel like they've fallen down, or uh, not met their own accountability, but recognizing that that's actually a rich territory to explore, and what can we learn from that and move forward. I think that's also what's exciting to me, because I really like working in the positive and joyful and flow kinds of aspects of life more than ever. And so getting bogged down in perceptions of failure or shortcomings is not an area that is life enriching, I think.
Yeah, as you're talking there, I was saying I've been in and out of research my whole career. And if there's, we hear the talk, you learn more from failure than you do from success. And in research, that is, I heard it early, but it was decades before I really got excited about failures because that's truly where we ended up learning a lot. And it wasn't
Right.
don't try to hide it, let's talk about it. Because
Yeah.
that's where usually the bigger opportunities are. Success was either we didn't set the bar very high, so success was easy. That's okay. So maybe we
Yeah.
can raise the bar a little bit higher.
Yeah.
But it's the failure because that's what we're trying to do, right, is to break the cycle. And so that's, I think, where you're getting at is we're trying to break those cycles that are leading us, in some
Yeah.
other or competing with where we're trying to go or competing with
Right.
what we truly value. So yeah,
Yeah, because when people dive into that, they're diving into a different part of their brain that loses its capacity to imagine a next step, right? Because they're locked into this negative framework and judgmental framework doesn't allow them to work in the creative and the expanded viewpoint of meeting their goals.
yeah, and they probably are overlaid all sorts of external expectations on it that are really worthless anyway,
Yeah, yeah.
that we think others care or that we're being measured against some other things, whether it's our Instagram profile or our
Or lack
career
thereof.
profile or whatever, right?
Right.
Of imagining that everyone's watching us that closely or cares that much. But yeah, it's no, I think I just think it's a great opportunity. I think there's a real need for the kind of skill that you have. I think listeners. I hope we have some coaches out there listening that are kind of going to have some takeaways here of like how it goes back to that curiosity, right? How can I be better at whatever I'm doing? And I think that's really where the magic gets really fun. And so Kate, we should probably wrap this up, but I want to thank you for kind of sharing some of your thoughts. You've been a great partner for me as we've been talking about many things over the last year or so. But really, I think in the coaching is a place looking forward is going to be a growing area because it really is making up for the elements of what traditional medicine just was never designed to do. So we're seeing an opportunity. It's not going to be able to step in and do that in any big way, certainly not overnight. So I think for a lot of people, this is going to be a really important area. For people who want to maybe reach out, I'll certainly put links for your website or anything else you'd like in the notes. But if you want to kind of share some thoughts, maybe for people to think about as parting thoughts, I'd be very interested in kind of what you might want to leave as a message.
Scott, it was a pleasure to talk with you today and to, explore and with the audience, the field of health coaching and how it provides so much opportunity and possibilities for people to achieve their health wishes and over their life course. I'd be happy to talk with anybody in the audience about the field of health coaching if they're considering it. I'd also be delighted to speak with anybody one-to-one in an introductory call to expose them more to the field of coaching.
Sounds great. Thanks again, Kate. Best to you, and thanks for being part of this with me today, and thanks for choosing the kind of work that you do. I think it's just so important.
Thanks, Scott.
Hope you enjoyed today's show. Great to have you part of our over 10,000 strong WealthSpan community. Remember to subscribe if you'd like to learn about our upcoming shows. And as always, make sure you provide some feedback, whether that's a thumbs up or a comment, a question. They're all welcome. If you'd like to subscribe to our quarterly newsletter, you can do that at wealthspan.com. We're always looking for show ideas, or maybe you think you'd like to be a guest. Again, please reach out to book a motivational talk or inquire about our leadership workshops. email me at info@wellspan.com. Until next time, stay engaged, stay curious, take good care of you, those in your care.